Dr. Crossman, let me turn to you for a moment. One of the questions that we have is that not everybody is going to be vaccinated right away. That's been the frustration, I think, that everybody feels, including you folks, because the doses have not been delivered as promised by the pharmaceutical companies, at least on schedule. So a lot of people are wondering, what do you do to protect yourself in the meantime between now and the time that you or your children are able to get the shots?
Well, first, good health hygiene. So that's hand washing, that's not touching your face. If you're exposed to somebody with illness, try to stay at least 6 feet away from them. That's, good basic message there. And then certainly, if you happen to be the person who is sick, who may have the flu, well, you know what? Distance yourself from others to protect them. Cover your mouth when you cough or sneeze. But again, it comes back down to basic hygiene, and I see we have an alcohol-based hand gel on the table there. That's a wonderful thing as an adjunct to hand washing.
And a lot of the schools now have them, as I've noticed as I've gone to my own children's schools. They're everywhere. You see them in businesses, et cetera. So I think that message has kind of gotten out over this.
Yeah, they are ubiquitous, but you have to use it.
Now, what if you don't? Okay.
I was going to say, we're the only state in the country that has alcohol hand gels in all the schools. The governor put those in a couple years ago.
Now, if somebody doesn't have one of these gels available, obviously there is a soap and water technique that we all grew up with our parents saying, wash your hands and so forth. Is that equally as safe, or is it secondary to the alcohol-based hand gels?
As safe, as effective, but you really have to wash your hands for 30 seconds, soap and water, to be the equivalent of the hand gel.
30 seconds?
Sing happy birthday. That's what I learned from one of my daughters.
Sing happy birthday to yourself and then you're done. Huh? Dr. Alexander, let me ask you this question, and this is actually my own. I've seen some studies that show that hospital healthcare workers, 60% of them so far have been reluctant to get the inoculations. That gets kind of scary because you think, well, people who work in the healthcare business ought to be those who would be first ones to go out and get it. Now, I think in this state, Rhode Island, I think Lifespan has done a good job in getting their own people who are doing it. I think their numbers are much higher than that. Why is there resistance with the healthcare workers?
Well, Lifespan has done a good job this year, actually. I understand that it was up to about 70% as far as the vaccinations go within the hospital. And I believe that healthcare workers know that this is an important protection that is available for themselves, in addition to for the patients and their families as well. So this year in particular, we know that the vaccination rates have increased in general, and that includes the healthcare workers who recognize that it's necessary.
I'll also ask this to you. We have a graphic also to show. Either you or Elizabeth can also chime in on this if you like. When we talk about influenza-like symptoms, sometimes people get that confused with the cold, with the flu, with swine flu. They're not really quite sure what it is. Let's go through this. What are influenza-like symptoms that people ought to be paying attention to identify clearly that this is the influenza?
And what the CDC is using as a definition is fever and cough or sore throat as influenza-like symptoms. They should have fever and a cough, or fever and sore throat. Other symptoms that can go along with it are runny nose or stuffy nose, body aches, headaches, vomiting or diarrhea can occur as well. But fever is one of the primary things, along with the cough and sore throat.
As we leave that up, let's put that back up again if we can, Dave. What's the difference between having a cold and having this? Because some of these are shared indications.
Right, that's true. With a cold, you can have a cough, you can have a sore throat. Oftentimes with a cold, although it's possible, but oftentimes you don't have a fever to the extent that you do, and you don't have some of the associated symptoms that were just up on the screen. The severe fatigue, the chills, the severe body aches. Nausea, vomiting, and diarrhea, they don't always go along with the cold as well. So It's when you have the compilation of all of those symptoms together with the fever, then it's probably an influenza-like illness.
So again, if you have most of those indications, then you're probably talking about the influenza and not talking about the cold or something else.
Correct.
And honestly, it does not matter whether you officially have the definition of influenza or you officially have the definition of a cold. The symptoms are comparable, they're similar, and the treatments are very similar too. The change becomes when somebody gets a secondary complication or secondary symptoms, and those are the things that we're trying to counsel families to look out for.
Yes.
Early on in September, we had a lot of people with influenza-like illness in Rhode Island, but only about 10% of them were testing positive for influenza. They were having other viruses that were causing that. Now that we're seeing the outbreak of H1N1 in the last couple of weeks, about 50-75% of people with that. So still, a lot of people who have that symptom don't have influenza. That's why they need to still get the vaccine even though they've had the symptoms.
Okay, I'm one of these people who identifies with some of these indications that we just put on the screen. At which point do I call my doctor without unnecessarily bothering them, because God knows they're busy these days?
I think it's most important, at least for children, to have their parents call their physician if they have concern. If their child is not acting right to them, that's something the pediatricians want to know from those parents. However, please realize that pediatricians are working hard, as are all the other healthcare workers, and please be patient with the phone lines. We're all trying to get to the families as much as possible, as quickly as possible, and everybody's concerns are important. But the medical symptoms that we look for are fevers that aren't getting better with Tylenol or Motrin, or because this is a respiratory illness, we worry about increasing respiratory symptoms like difficulty breathing, bluish color on the skin or the lips, dehydration, pain in the chest, someone who's irritable or lethargic, not really waking up or interacting. Or what we're also seeing is kind of a biphasic, a twofold illness. It seemed like somebody got a little bit better, and then the fever came back and the cough changed or the ear pain started. And certainly any fever with a rash, the medical community would like to see that person.
What about the medicines that are available for treating the flu?
The medicine that's available is an antiviral medication that's referred to as Tamiflu. It's important to distinguish. I understand that there's been confusion between Tamiflu and Theraflu. Those are two completely different medications. Theraflu is available over the counter. For children younger than 2 years of age, it's actually not indicated. What is in it is basically acetaminophen, which is Tylenol. It also has a decongestant and antihistamine. That's all within Theraflu, and that basically works on the symptoms, trying to make it so that you don't have as much pain, the fever isn't as high, not as congested. That is different from Tamiflu, which is the antiviral that's used to treat influenza when it's indicated to be treated. As has been mentioned, not everyone automatically needs treatment for the influenza. Swine flu that we're discussing tonight. Oftentimes people can get better on their own. But given the symptoms that Dr. Lang just mentioned, when you call your physician, then you can make a decision with the physician about whether or not it's appropriate to treat if the symptoms are severe enough.
Dr. Gifford, pardon my subtle amusement here. Last week, you were kind of sidelined a bit, were you not? Here's the spokesperson for all of this, and then you were sidelined with, was it swine flu or was it influenza, or do you know at this point?
Well, I guess by the definition I had influenza-like illness. I had a fever and a cough. I had some aches and chills as well. I didn't have a little headache. And I stayed home. I drank lots of fluids and I took Tylenol. I never got tested because, as Dr. Lang said, it didn't really matter. And I didn't take any antiviral medication because I'm sort of healthy and I don't have any other illnesses. Individuals, though, that have asthma or diabetes or heart disease, or adults or kids who have those underlying illnesses, they should be calling their doctor to get on the antiviral medication, because that can be very helpful for them. That can help prevent the getting worse enough so they don't go to the hospital.
One of the questions that was called into us was this one, and it's an interesting one. Should I get a prescription for Tamiflu just in case I get sick?
That's an understandable question. They should not have it just in case for storage purposes. As have been mentioned, it should be preserved for moderate to severe illness, and if you have any underlying diseases, and that should be prescribed only by the physician when it's appropriate to do so.